Hello, my name is John David Berdahl, and it is the 4th of July here in the United States, and this is a pretty big holiday here, and the sun is just coming up, so you may see it start to shine behind the tree behind me. And so, yes, I'm going to be talking about today unmasking. The title of my presentation today is Unmasking Hidden Challenges, Skill Regression, and Rejection Sensitivity Dysphoria in Autism Spectrum Disorder. Okay, a little bit about myself. I'm John David Berdahl. Hi. And I'm an ASPE, a writer, an artist, and a musician in Moorhead, Minnesota, and also Fargo, North Dakota. That's in the American Midwest. And they're right next to each other. I could say just Fargo because a lot of people have either seen the movie or heard of the TV show or heard that name, but I'm actually from Minnesota, Moorhead, Minnesota, just across the river. And I was diagnosed with Asperger's syndrome when I was 30 years old, and I am 41 right now. I just had a birthday. And I do educate individuals, families, lots of families, and also the community here about neurodivergence and autism spectrum disorder. And I also mentor a number of individuals. I do that like with driving, with shopping, with activities of daily living and life skills. So I'm a life skills educator, life skills tutor. And that's going really, really well. And so today I'm supposed to talk about two really important, I suppose, sort of topics or subjects, okay? And so, yeah, I'm an autism advocate and an individual myself on the spectrum. I suppose I don't have to say Asperger's syndrome anymore because that's kind of been dissolved or eliminated, but I still bring it up anyway. So to acknowledge the history, right, of certain diagnoses and the certain, like, progression, how autism itself, like the diagnosis, has progressed, right, through time. So today, there we go, move that up. So today we're going to explore some of the often overlooked emotional and behavioral aspects of autism, specifically focusing on unmasking skills regression or just skills regression, right? And rejection sensitivity or sensitive dysphoria or RSD, okay? I don't really experience these myself that much. I haven't really had to unmask. I've been unmasked my whole life. I have mirrored behavior, but I haven't really masked that much. I haven't, because alexithymia for me, I talk about that. I hit this sort of sweet spot or Goldilocks zone where, yeah, I don't really know how to feel anxious. I don't know how to feel scared. I don't know how to feel embarrassed. Also, I'm biologically male, so I don't have that relational, I didn't have that relational intelligence that I was supposed to have until I actually cultivated that. And so here, let's bring up the slide. There we go, share screen. Start. So yeah, I'm going to share the screen here. There we are. Okay. Turn myself off there. Okay. There we go. So let me go back. There we go. I was looking at some of it. Yes, it works. Great, great. Wonderful, wonderful. I didn't actually test the whole thing out. So here, let's do this. And we'll play it. Okay. Present on this device. Swell. Yeah, how about I start at the end and go backwards? Oh, golly, here. There we go. So, there we go. So autism is a complex condition, okay, that affects individuals in unique ways. While many discussions center around the more visible traits of autism, today I want to delve into the emotional and behavioral challenges that often go unnoticed. We will discuss how stress, right, and sensory overload can lead to skills decline and skills regression, and how intense emotional reactions to perceived rejection can impact daily life. My goal today is to foster a deeper understanding, empathy, and acceptance of neurodiverse experiences or neurodivergent experiences. So here's the introduction slide for you. Give you a chance to read that for a moment. And so, yeah, with some clients that I do work with and students too, yes, these issues do definitely come up. They do believe just because I disagree with them, that they're being rejected, or they believe that they're unwanted, or they believe they're undesired or undesirable or something like that. I don't really have that emotional experience. So sometimes it doesn't really occur to me that that's going on. At least it didn't for a little while. I had read about these subjects, definitely, but it hadn't really occurred to me that, they would be experiencing them so intensely, So here's the next slide. So skills regression. Let's start with the concept of unmasking skills regression, and specifically unmasking. So unmasking refers to the process where individuals, particularly those who are neurodivergent, stop suppressing their natural behaviors to fit into neurotypical social norms. And as I had said, I didn't really experience that sort of thing because I didn't see that sort of big picture, that I didn't belong, so to speak, or that I didn't know how to belong, or that I wasn't supposed to belong, so to speak. And so I was just, I guess, authentic, but I didn't really have a sense of self, if that makes sense. And I deal with clients and students who definitely have that. They have these sort of collection of responses, but they don't really know themselves. They do answer to their name or the name they've been given, but they don't really know intrinsically how they're supposed to feel about one sort of, idea or one sort of situation or another. Here we go. And so unmasking, while this can be liberating, it can also lead to what we call skills regression. This is where individuals may experience a decline in previously developed skills as they embrace their authentic selves. Okay, so what does that mean, right? The skills that they had, like skills regression. So regression itself is just like what it means. And so when someone is stressed, right, or someone is experiencing something that is distressing, they sort of revert, or they return to an earlier sort of stage in their development. That's sort of what regression means. And so when we're discussing like unmasking skills regression, what does that sort of look like, right? There we go. So that can look like definitely. So let's talk about, I'll bring up this slide too, factors leading to skills decline, so I can allow you to read that for a moment. And I can talk about examples of skills regression, that may occur during unmasking. So definitely the first one I was going to bring up was communication. Okay, so a person who had been pretty talkative, pretty verbal, loquacious, I think is the big word for that, as they begin to unmask, it may look like they don't know how to hold a conversation anymore. Okay, so concerning communication, individuals may discontinue or struggle with verbal communication, or prefer non-verbal methods because it's so draining to kind of keep up with a conversation, right? Or small talk, right? They may not engage in small talk anymore because it's just so overwhelming, or perhaps, they just don't need to be burned out anymore. Concerning social skills, challenges and social interactions that were previously managed through masking may arise, okay? And so maybe they may look incredibly disagreeable or rude or something like that, Hopefully that doesn't occur too much. Concerning hobbies and interests, there may be a loss of interest or ability in activities once enjoyed, okay? Because it can be so incredibly draining, or, they just don't need to be burned out anymore. They don't need to be exhausted anymore, okay? Daily living skills concerning those tasks like cooking or self-care may become more difficult, or apparently more difficult. Okay, so let's move on to the next slide. This slide is titled Role of Stress and Sensory Overload. So I'll give you a chance to look at that. I'll talk for a moment. And so how do I deal with some individuals, there we go, who are manifesting or exhibiting sort of that I don't push them too hard, or I don't expect too much out of them, or I don't demand too much out of them, because of course that may lead to, so much demand avoidance. If I really do observe that someone, especially some clients that I work with who have masked around family and who have coped in a certain way, making certain that the needs of their family are sort of met before their needs are met, the individual's needs or the client's needs. And so as they begin to become their real authentic selves, their real genuine selves, and they really start to say no to some things, and they really start to unmask. I've had a lot of conversations with families or family members about kind of like, oh, we better talk to his or her doctor, about what's going on. It doesn't seem like he or she knows, how to, it doesn't remember how to do this, or the autism is flaring up. I've heard that one. Oh no, the autism is flaring up. We may need more meds or something like that, or we may need more therapy. And it's like, no, this isn't something that needs to be fixed. Definitely let's talk about it, and let's engage it, but let's allow the person some time and some space and definitely some grace to figure out and to ascertain how it is that they ought to manage these stressful or distressing, as I had said, or these complex or complicated situations, right? Okay, so it's important to note that skills regression or skill regression during unmasking is often a temporary phase. Okay, and that's what I do talk to parents about or families about, okay, or I suppose guardians, guardians too, that this isn't as soon as, let me continue with this. As individuals navigate their authentic selves, they can regain lost abilities or learn new ways of functioning. And that's what I was just about to say, is that they will find their way of approaching some sort of task, right? Or some sort of circumstance, instead of the one that they had sort of learned or perhaps been conditioned, right? The manner in which they had been conditioned to figure things out or sort things out or conduct themselves, So support is crucial during this time. Understanding the reasons behind skill regression and providing appropriate resources can facilitate the unmasking process and help individuals rebuild their skills and well-being, okay? And so that's huge. Supportive interventions for recovery. I'll give you a moment to look at this. And so what I do engage in, or what I do make certain to do, is yes, I do intervene, as soon as I notice that perhaps it's taken quite a while to move past, the certain phase of regression, this kind of skills regression, and I don't force anyone, I don't coerce anyone, but making certain that, certain therapies are being applied either by me, or therapeutic practices, okay, are being applied by me or by, a licensed or certified therapist or counselor, and then of course, consistent routine, of course, concrete language, of course, making things more clear and more established, and more apparent for the individual is just going to help out any human being, but especially those who identify as neurodivergent, and different types of visual and audio supports too. That's going to be great. And so, encouraging gradual exposure in this slide, I'm just reading it right now. And so definitely exposure. When I talk about, because people ask me, is there a cure for autism? And I will let them know that the closest one that I found is exposure and interest in mentoring. I learned that from Dr. Temple Grandin, exposure, interest, mentoring, okay? And so during this time, when the individual is unmasking and their skills are regressing, this phase, this stage, this level, that they're at, as they proceed, like I myself was a level 2 autistic individual, and then I put in the work and I became a level 1 autistic individual. And I hardly need that much support myself, because I know how to advocate for myself and make certain that I have most of my needs or interests, right, or sort of fascinations met, so I don't really need to rely too much on others, but I can, though, I'm not too proud about that sort of thing. But and so while the individual is experiencing maybe a delay, sort of a delay or sort of slowdown during this process, of unmasking and really establishing themselves, in their sense of self, in their sort of behavior and their sort of life, we ought to call it that. I make certain that I expose them to different ideas, different processes, right, different practices. And if there is no interest, I just leave it alone. I absolutely just leave it alone, and so, I do not pressure, I do not push, I do not, it's just not a very good idea. And so, and so there's so many different strategies to be talked about. Once we get to the Q&A to the end of this, we can talk about a couple different, it's like, would ABA help out? What is it called? CERTS help out? Would there be types of, I got done talking to a colleague who had no idea about what like a therapeutic play was, or floor time, there are a number of different ways or different avenues that one can pursue to make certain that an intervention can be made if it's necessary, and it's a very gentle and it's a very delicate, right, sort of a situation that, it's like, are you supposed to intervene as the person, if they're really struggling? Definitely, if they're really struggling, it's too much of a challenge, if there's definitely disadvantages to what's going on to the individual, to the client, to the family member, to the person, yeah, you ought to do something or say something, and help them out, definitely help them out and guide them through that sort of process, right, or growth of unmasking, and then basically returning or learning new sorts of skills that they can bring into their own lives or lifestyles. Okay, so now we need to move on to rejection sensitivity dysphoria. Okay, and so, or rejection sensitive dysphoria. Either one. I've seen both and I've read both and I talk about both. Okay, so yeah, we're going to shift our focus to that. All right, RSD. And it's characterized by intense emotional reactions to perceived rejection, which can be overwhelming and debilitating. For individuals with autism, RSD can significantly impact their daily lives and relationships. And I have seen this, and they just shut down. I've seen the person shut down. I've seen the person go into this kind of depressing or depressive sort of state of mind. And it's all, it's easy to say, it's very easy to say that it's all inside their heads or something like that. Of course, that's something, but, it's also based on past sorts of experiences that have informed them of what perhaps rejection may look like or possibly look like, and they've been told for most of their lives. And I do understand that. I do understand what is, I talked about what it's like it seems like I don't belong or something like that, because maybe I've been scaffolded, but definitely my own father did that for me. There was scaffolding that had gone on early in life. And so when that wasn't going on, when I wasn't being set up for success, now I wasn't necessarily being insulted or demeaned or devalued or anything like that, but I wasn't being encouraged, right? And I wasn't being as celebrated and applauded and lauded as I had been before. That did seem like, oh, okay, perhaps these people don't like me, but I don't really know how to care about that. Again, I don't know how to be worried about that. I don't know how to internalize that, whereas some of the clients I work with really do, and so it can be sometimes very difficult to make certain that someone is supported, but also understands the reality of and the idea of fairness. It's like some people they're not going to have the energy or the will or willpower or focus, concentration, right, or desire to even attempt to, support an individual with autism spectrum disorder, with ADHD, with OCD, with perhaps any neurodivergent sort of condition, diagnosis, right, or situation. So understanding rejection sensitive dysphoria, right? And so people with RSD often experience, right, an overwhelming emotional reaction to even mild forms of rejection. Okay. And so I was just talking about that. So I could understand that, and so when someone just disagrees or if someone's not paying attention or someone just is unresponsive, that may be definitely with the clients I work with and students, they do see that as, oh, this person, I'm being rejected, I'm being dejected or something, or feeling dejected, or, they are just feeling like, or they just, all of a sudden they understand, for themselves that they are not welcome, they are not invited, they are not connected, not useful. Golly, it's really intense. It is really, really intense when it occurs and when I see it, and so I make certain that, again, here, I'll get to that in a moment. So, so RSD and the RSD experience, right? They experience, right? As they're experiencing RSD, there's also anticipation of rejection leading to social withdrawal, right? Low self-esteem and negative self-talk, obsessive thoughts about perceived rejection, okay? And these traits can create a cycle of anxiety and avoidance, further complicating social interactions. And that's what I was just about to mention. I'm kind of bouncing between, what is technical or, what is clinical, right, concerning definitions and examples, and what I have seen through, I guess, lived experience and, so professional observation. And so, yes, the anxiety that rises, the anxiety that just like occurs and rises and increases for these individuals. Oh my goodness, when they're experiencing RSD, I just I do try and help them out. I do, but it's like when you even acknowledge the anxiety, that increases, right? That advances, right? That magnifies, amplifies the anxiety so much. And so when I'm working with a client who is definitely exhibiting or showing, RSD, and definitely and starts to obsess about it, I will start to, and not so much change the subject in a very brazen or in a very crass sort of way, but I will, make certain that we stay task oriented or task focused, while at the same time, talking about their feelings. And that's what I do. It's like, because I'm sort of an outsider, an outlier when it comes to feelings. And so it's kind of like, okay, let's still work on this, but tell me all about the way you're feeling. Can we do both? And so that also encourages multitasking as well, or multitasking sort of skills. And so, the impact of emotional reactions, right? And I ought to say too that RSD is not exclusive, okay, to individuals just with like one diagnosis, like ADHD, or as I said, OCD or ASD, like autism spectrum disorder, right? It is also prevalent across, diagnoses. Okay, the heightened sensitivity to rejection can stem from past experiences of criticism or neglect, leading to a learned behavior of hypervigilance in social situations. And I have seen that so very often. Oh my gosh, yes. People just anticipate, clients that I work with, even just like friends that I have on the autism spectrum or who identify as ADHD, or with Tourette's, or dyslexia and dyscalculia, and so on and so on. When they, it seems like they're just anticipating it. They're anticipating pain, and suffering and difficulty, when it seems like they ought not to be, because of, yes, these past experiences or these learned experiences where perhaps family had been very overcritical or sort of harsh or difficult with them, or definitely disagreeable. And so when they're spending time with me, they will sort of put that on me a little bit. And I have to sort of break that kind of behavior, not through any sort of like violence or being like active, or not in any physical sort of way, but definitely in an intellectual way that hopefully resounds or allows for a resounding emotional sort of effect, or an increased emotional intelligence, where I will let some people know. I'll just say how I often begin to talk about it. If they're behaving a certain way with me, they're anticipating that I'm going to disagree with them, right? Or that I'm going to be critical of them, or reject them. I will just look at it, and you have to be quick about some of these things, or you have to be really on the ball about some of these things, right? And some of these conversations. As soon as they start to exhibit that or show that or do that, right, I will say, it's like, I'll let them know, give them feedback right away. It's like, it seems like you're continuing a conversation that you started with somebody else or someone else. It seems like you're doing that with me. And it's like, you don't really need to. I haven't thought those things and I haven't said those things, but go ahead and feel your feelings. I'm not going to tell you that you ought not to. They're there to protect you, and it seems like, and if you do believe you need protection right now, go ahead and behave that way. As far as I know, I really appreciate you and accept you, and definitely are very, very curious and very very understanding of the fact of how necessary you are and important you are and essential you are to me and to others. But if you do need to retreat, or if you do need to escape or go, or go somewhere else, right? Or be safe. If you do believe you need to be safe, go right ahead. But no, that's not going on with me. And I do apologize that, I'm not being critical of you, but if you do think you need to, do that, go ahead. And I hope things change with whomever it was you did have that conversation, that initial conversation with, okay, strategies for emotional regulation. So go ahead and check out that one. Right. So how can we cope with RSD? Right. Here are some strategies. All right. Challenge negative thoughts, replace negative interpretations of social scenarios with more positive ones. And that's what I attempt to do with clients, students, friends, and colleagues. Okay. Engage in distraction. Find activities that can shift your focus and mood. And that's what I was talking about, making certain that we complete tasks while still talking about some of, the emotions or the feelings, still moving in a certain direction, or possibly away from whatever it was that was the catalyst, right, or the impetus for a certain feeling. Communicate, right? Share your experiences with trusted friends or family to foster understanding and seek professional support, right? Therapy can provide tools to manage RSD effectively. Okay, so conclusions, right? In conclusion, unmasking and RSD are critical aspects of the neurodiverse or neurodivergent experience that deserve our attention and understanding. By fostering empathy and awareness, we can create supportive environments that empower individuals on the autism spectrum to embrace their authentic selves. Okay, thank you for your time today. I hope this presentation has provided some valuable insights into the hidden challenges, and they can be totally hidden, right? They can be until they rear their heads, faced by many individuals with autism and so on. And I'm supposed to look forward to your questions, right, and discussions, right? Now I'd like to open up the floor to any questions or comments, right? Here, let's get back. Here we go. Oh, there are no questions. Well, that's good. So yeah, there we go. There, I'm back. And so yeah, I can talk about personally again. So I did have a client that I had been working with, and he really was adverse to being in public sort of areas because he was anticipating or expecting that someone was just going to call him dumb or point out. He wasn't even, not so much sure that he had autism, but he wasn't really agreeing. He wasn't really convinced. There we go. He wasn't really convinced of the diagnosis that he had received. Okay. And so there was part of that. So it's kind of like being in situations, and if I did agree with the diagnosis, being a DSP with the individual, and just working with them. But I had said, hey, you, so I'm not just going to force you to behave this way or act like an autistic person if you don't think that you are. But he definitely had a lot of the traits, a lot of the characteristics. And I talked about that with his family. And so it wasn't my job to persuade him of anything, like persuade him that he had autism, but make certain that he could engage with individuals, with groups, right, with certain systems in a very meaningful way. And so we had a lot of conversations. And of course, he would definitely start to obsess about, was that person looking at me this way? Why would that person say that? Why would that individual just walk away while I'm talking? And so I would be like, well, it seems like the person, and I would often put it in a sort of category of other people not being sort of intelligent, or not being, just to make them feel better, definitely, but not like hate individuals or demean them or insult them or anything like that. But I would just say kind of like, oh, well, the person must have been really distracted themselves and they didn't know how important you are. That's going to happen sometimes, but I see it. So let's keep working on this. We would go shopping. Let's make certain we find like a Target. Let's make certain we find what we're supposed to get, at this department store, this Target sort of department store. And there would be that. And it's like, would ask, why would this person do this? And why would this person do that? And that's one of the reasons, that's definitely like the main reason I had thought, you see this autism diagnosis is pretty appropriate, because he was just delving or basically so absorbed in psychology and philosophy and law and trying to find out through these really big sort of concepts or big sorts of fields why it is that human beings behave the way that they do, utilizing sort of uncommon knowledge instead of common knowledge to really answer lots of questions. And so, I would make certain to let them know. It's kind of like, well, often you're going to run into some people who don't know as much as you do, who aren't as intelligent as you are, who aren't as smart as you are, who don't look at, certain patterns as much as you do. And then that helped to de-escalate the situation a little bit, where it's kind of like, well, that's just kind of real life, and in real life, some people just don't, really understand some things, don't know about some things. Some people don't know how to care, and it's not really, we don't need to assign blame, it's just like me, like I brought up my autism, or like autism for me is like, I didn't know how it was, like concerning nonverbals, definitely. I wasn't selectively mute for a number of years. Oh, shoot. Okay. So it's 8:30 my time right now. So it's been about a half hour. And so, yeah, I just let the client know, Yeah, some people just don't know things. So do try and be patient with them and do forgive them. And that seemed to help out quite a bit. And so, yeah, if there are any questions in the future, you can find me on social media at really John David, because I'm really John David. You can email johndavidberdahl@gmail.com, and I can answer some questions that way, or we can have some definitely really important and really, really insightful and really impactful sorts of conversations, hopefully in the future. So thank you so much for this opportunity to talk about this. Yes, thank you so much. Like, thank you, definitely. I was just reading the chat. Yes, thank you. Hopefully you have a great evening where you're at, or wherever you are. Hopefully you have a great time. Thank you.